International aid group Médecins Sans Frontières has been trying for months to gain access to Syria to care for the injured. As negotiations drag on, it's been working on the ground without official authorisation. It's even set up a secret hospital where it's treated more than 300 patients and carried out 150 surgeries. Australian Brian Moller was part of the team that worked in the makeshift hospital. He's an anaesthetic nurse who has been working with Médecins Sans Frontières for the past 9 years, and he joins us now from Paris. Brian Moller, thanks very much for talking to us.
Good evening to you and the viewers.
Talk of secret hospitals raises a considerable sense of intrigue. How does an organisation like MSF go about setting one up in a nation that's rapidly deteriorating into the conflict zone that it now is?
Not an easy job by any means, but the medical needs, the medical exigencies dictate that we do act. We've actually been working in Syria for almost 1 year now without an active presence on the ground. We've been assisting with donations and with material expertise.
Just explain for us, if you can, why there was a need for a secret hospital like this.
We saw a worsening and a degradation, especially in the health context, and an escalation in the violence. Hugely problematic for especially civilians to obtain adequate health care, so we decided to intervene directly.
And what sort of conditions were the health of professionals like yourself treating?
Victims of violence, victims of the conflict, both from FSA, from the FSA military and for civilians. We're seeing a lot, particularly lately, we're seeing a lot of large ordnance injuries, victims of bombardment, tank fire, aerial bombardments, sniper victims and gunshot wounds.
And who are the patients typically? Are they rebel combatants or ordinary civilians who've been caught up in the conflict?
We're treating both at the hospital located in the north of Syria. So recently we've been receiving a lot of patients who are managing to escape Aleppo to get to our facility for treatment.
Can you tell me a little bit more about the conditions you've been working under?
Very, very difficult. It's a small team that we've put on the ground. There are 7 expatriates and we're working with about 50 national staff. It's a very small hospital, 12 beds, but we have the capacity to accept 30 patients. We're running an operating theatre, a recovery room, a resuscitation room with 3 tables and a small emergency room. We're very, very busy, working round the clock, literally sleeping 0 to 3 hours per night, but we're achieving good results.
And what about the Syrians themselves, the health professionals, the doctors, the nurses that you've been working alongside, and the other Syrians that you've obviously had daily contact with there?
There's a very, very good base knowledge amongst the Syrian personnel working in the field, but it's evident that they're not used to conflict work. They're not used to seeing injuries on this grand scale. The health system, especially in the opposition areas, has largely been driven underground. So most of the health provision is now being run in underground or in clandestine facilities.
You must have seen a remarkable transformation in that country in the time that you've been involved there. I guess by way of comparison, Syria is a country not dissimilar in size in terms of population to Australia. And I guess it must be like having seen conflict breaking out in Australian cities.
It's a hugely traumatic process for the Syrian people themselves. This is, as I mentioned before, this is their first real experience of all-out conflict within their country, and they're having trouble dealing with it. There's huge physical and psychological impact on the Syrian population.
Meanwhile, it's a fraught task too for the MSF volunteers and workers, particularly when you align yourselves with one side in a conflict like this.
Mm-hmm. We're, by virtue of the fact, accessibility and security, we are operating within opposition and rebel-held areas, so we're only seeing a part of the picture. We're fairly confident that supporters of the regime are able to access healthcare in the existing public health system, but in the opposition and rebel-held areas, we know that hospitals and medical staff have been actively targeted. So this is where the problems lie in in regard to access to adequate healthcare, especially for the civilian population.
Well, and is there a risk too that even talking about MSF's involvement inside Syria runs the risk of making yourself and your colleagues a target for pro-Assad forces?
That was a fear for us initially. We decided that we would inform the regime of our presence, and we did that at our opening. Of course, they weren't too happy about it. They did point out that we were in the country illegally, which we accept, and they did point out that we were in the country at our own risk. Our organisation and the workers on the ground deemed that those risks are acceptable.
Did you feel personally threatened at any time in your time within Syria?
Not directly threatened, no, and thus far we haven't been actively targeted. We are fairly close, we are located fairly close to several active front lines, so we were feeling and hearing and seeing the shelling on a daily basis, but so far we've been able to maintain our operations in a safe manner.
Brian Moller, do you have a point of view about the politics of what's going on in Syria?
No more or less than any other conflict zone I've worked in. This is now my 12th mission with MSF. All violence is wrong, and there is going to be no solution as long as people are using violence as a recourse to action. We would like the violence to stop, and we would like a diplomatic or a political solution to be found and access to be gained for the patients to receive health care.